For being here tonight and for contributing to the assessment and making it even stronger. And I know we talked a little bit, we're talking individually about the assessment and why we do this report, and it really is to provide an opportunity to other agencies to start coming together and to really partner with us to move some of the health indicators or some of the health issues in our community and to address those and see how we can all work together towards achieving healthier outcomes for our families. So tonight we're going to be having an open conversation, an open discussion. We're going to hear from Steve Redini, which is from Health Resources in Action. Like Christine said, they've been our partner. They were actually our partners from the past assessment that was done. And this information is going to be available for everybody, anyone who wants to look at it, anyone who wants to access it. We will be available to answer any questions also once the report comes out. If you guys are interested in knowing what the result was, you know, what happens with all this conversation and how do we move forward, we're going to be here to be able to answer those questions for you. So with that, I'm going to pass it over to Steve, and he'll kind of get us started on the community meeting.
Great. Thanks, Christine and Liz. Before we begin, I just wanted to check, does anyone need Spanish language translation, or everyone good with English right up front? Yeah? Okay, good. Well, what I want to do is, before we get started, it would be nice to know who's here. We have a small enough group of folks, so could you tell me your name and why you're here?
Hi, my name is Alma Alvarado, and I'm a student from Incarnate Word University, and I'm here to be involved in the community.
Okay, great. Thank you.
Hello, my name is Irma Mancias. I live 2 blocks down from here, and I'm interested in what's going on around my community. That's why I'm here.
Okay, great. Thank you.
Hello, my name's Margarita Navarro, and I live like 2 blocks away from here also, and I'm also interested in what's going on in my community.
Okay, thank you.
Hi, my name's Maria Quintero, and I'm from the Zumba class on Mondays, and they thought it would be a good idea for us to come.
I'm Veronica Cortez, and I wanted to see what kind of things were out there in the community.
Okay, great. All right. Why don't we come over here?
My name is Brianna Mireles. I'm also from Incarnate Word, and I'm here to be involved with the community.
My name is Megan Perez. I'm a volunteer from Our Lady of the Lake.
My name is Ernestina Maldonado, and I'm also a volunteer from Our Lady of the Lake.
My name's Allie, and I'm one of the program coordinators over at the Health Collaborative.
My name's Elena Martinez, and I'm a program coordinator at the Health Collaborative as well.
Great.
My name is Rachel Trevino. This is the first time I'm here. I was actually kind of come here for the Zumba classes, but I'm staying to hear what you guys have to offer.
You thought there was Zumba, we're going to do this.
Yes,
Maybe we'll do Zumba halfway through.
I'm Laura Miranda, and I'm here for Zumba classes.
You're here for the Zumba class, too. Well, I'm glad you're going to stay for a few minutes. All right, thanks.
Vince Garcia, and I'm here with the group.
I thought you were going to be here for the Zumba class.
Mary Garcia, also here to see the group.
My name's Eva Romero, and I was here for Zumba also.
Okay. So that's good. So for the folks that are here for the Zumba class, maybe we'll keep your interest. So the idea was, what we wanted to do is have some conversations. We've been looking at a lot of information and data. We've been talking to folks, and we also want to have a conversation with you about what you feel like impacts health or affects health. And if you think about it from a personal perspective, is when you think about your own health or your family's health, what are some of the things that impact or affect your health? There's no right or wrong answer here, but when you think about health and being healthy, what impacts your health? Yes? Everything. Okay, there you go. Everything. I had the same answer. What else? Are there specific things right now that are impacting your health? Stress. How many people realize that stress impacts your health? Yeah. Anything, in this economic climate, even more so. What else? the availability of resources. And if we think about that from the perspective of some people may have access to more of those resources than others, that can also impact your health. If you live closer to a transportation system or a bus and you can access those services, if you live further away, that can impact your health. What else? Anything else that impacts your health? Maybe having this meeting tonight instead of your Zumba class. What else?
Well, if I feel that people don't love me, that impacts my health.
Mm-hmm. Absolutely. Absolutely. Anything else? So they talk about kind of having support systems. If you don't have those support systems, that could be a problem. Anything else? Your diet. Why does your diet impact your health? You are what you eat. So if we're kind of eating healthy, there's a greater likelihood that we will be healthier. If we're eating kind of some of the things that I was eating today all the time in terms of chips, that might not be so good. So it really is about your diet. Anything else? Your neighborhood. Why does your neighborhood impact your health?
Well, because whether you're able to access certain services, whether you have the proper food available to you around your community, whether you have your clinics that are available around your area, accessibility to those, or just understanding where things are, that impacts your health. Because as much as you might want to be healthy, you may not have access to some of that.
There are studies that are out there that looked at zip codes in different cities, and various zip codes, people live longer than in other zip codes. So that also gets at this place about where you're actually living. If we just go, I just wanted to show one visual in terms of what impacts your health. So if we look at this visual, the biggest impactor or what determination of health is our lifestyle. Some of the things that we choose to do in terms of eating, physical activity. So lifestyle has a big impact on our health. And up here it could be anything from smoking to obesity to stress, as you identified, eating, blood pressure, alcohol, drug abuse. Another area of big impact is the environment. What are we saying, or what do we mean when we talk about the environment? What's an example of the environment and how that impacts your health? What's that? Those that live with you? Absolutely. So if you live with a household of smokers, your health is going to be impacted in a different way than if you didn't. What else about the environment? What's that? The schools. Why would the schools impact, why would they impact your health? Let me give you this, because you're absolutely right. Say it a little louder.
It depends on the schools that are around you, because it depends on what resources they have, like if you have after-school programs or after-school activities or sports, or because the more activities they have, the less kids will be out on the streets. And
or if they have sports or after-school programs, young people could be active, or they could be doing extracurricular things. Absolutely. So if we think about this in terms of the environment, it could be the schools. It could be what's going on in your own home. Any other environmental things? Clean air. What if you live near a highway? Or if you live near a place where there's mold? So those are going to be things that impact your environment. So that's another big area or contributor to affecting your health. The next area is biology. So if we think about that, that's kind of your genetics, that's who you are, that's what you're made up with. So some of that, no matter what we're doing in the other areas, that may be just what you're given with based on your genetics. The final area is around health care. So that is related to kind of the medical and healthcare services that you're able to access, if you're able to access those. So what does this tell you? What is this telling you when we think about what impacts your health or affects your health? What's the big area? What's that? Your lifestyle, right? Isn't that what that's saying? Lifestyle and then your environment are two big areas that are impacting your health. And yet when we think about how we allocate or spend our money, we spend a lot of money on health care. More than most countries out there. Not to say that we shouldn't, but when we spend all of our money there, we're not thinking about lifestyle choices in the environment. It gives us a lopsided effect. Anything else? Does this say anything else to you? Mhm. Say that a little louder. Yep.
Your health is determined a lot by personal choices you make.
So can you give me an example?
Well, people can choose not to smoke, and they can choose what to eat.
Yep.
And they can choose to exercise more.
Yep. Okay. So what about, let's take the choosing what you eat. What about a family that doesn't have a grocery store near them or doesn't have the same kind of opportunities that someone else has? Do they still have the same choices?
No, like I think you were saying, the availability and also the cost of food determines what you're going to eat.
Exactly. So availability, accessibility, and cost also have factors. So there may be an understanding about some of these issues, but we also have to look into availability and accessibility as well. Anything else? So thank you. Good point. Anything else that this slide tells you? So those folks who thought it was Zumba night, are you doing that just to get out of the house, or is there a reason why you're doing it? We won't quote you. But why do you come to Zumba class? It's fun. Exercise. Why are we exercising? Say it, you got it. To burn off some of the calories, right? No, say it. That's right.
I said you get to meet other people and you have fun with these people. And I enjoy it. The last Monday was my first time, and I've enjoyed the time that I've had with everybody here. I don't really know everyone, but I've had a good time. I was depressed last week, so it really helped me.
So in that feeling of maybe feeling depressed, you got out, you saw some people, you had some fun. Did it change the way you were feeling?
Yes, it did.
So think about all those people that may not have that opportunity, or think about that and then what happens. But in this case, it's a great example about how that opportunity that made itself available changed kind of your outlook. That's great. Any other observations? How about from people we haven't heard from? This making sense? Got questions?
Move a little at least, and then I'll go see the voice after I finish here.
You'll move a little, then you'll go see the voice. Okay, good. Anything else from people we haven't heard from? I'm looking over here. Any observations? No? Okay, we'll come back. I'll get you before the night's over. So again, these are some of the things to think about when we talk about what affects or impacts your health. If we could go back to that other slide, because really what we want to spend some time tonight is talking about this phrase called the social determinants of health. Most of you are probably thinking, what does that mean? What the heck is that? And all we're saying here is that there are certain things out there in terms of conditions in which people are born, grow, live, work, and age, including the health system. So the social determinants of health are conditions in which people are born, in which they grow, they live, and age, including the health system. Is there another slide that gives a little bit of some of the, I don't think so. So let's think about this for a minute. So the social determinants of health are conditions in which people are born, grow, live, work, and age. So the gentleman in the very beginning, when I asked you the question about what impacts health, you said everything. So this is kind of saying that, right? So when we think about concrete or specific examples about social determinants of health and the conversation we just had, doesn't everything you talked about impact health? Everything. So what we want to do tonight is ask you to think about maybe the top 3 to 5 things that you feel like impact health. And again, just from your experience, but if we can get some agreement, and then we want to have a conversation. We're going to have some small group conversation and ask you a few questions. So as you think about those social determinants of health, what would be some areas that you would like to talk about tonight? Based on the conversation we just had. What comes to mind as a priority or something really important? Think about it for a minute. Children. How so?
It's a mother's well, how can you say it? I don't want to say right, but it's a mother's way of making sure her children develop correctly, live to have a good life. And if they're not healthy, then...
So what do you want to do to make sure those children are healthy? What do you want in your community to make sure they're healthy?
Oh, gee, everything that is geared, geared
Such
toward
as what? Give me an example, because that could be one of the priorities we talk about.
activity for the children.
Okay, so some kind of activity. What kind of activity?
Well, schools nowadays don't have recess.
Okay.
And we were used to recess, some kind of a class specifically for exercise of some sort outside.
Okay.
Got
so
to.
let's use that. Okay, let's think of that as an example. So with schools, some very specific activities based in schools. All right, so let's hold that thought. That may be one area. What else? What other things do you want to talk about that may be priorities that will influence health status? And maybe, are you going to record them? Yeah. Because I know I won't remember them all. Okay. We'll go through the list. Say a little louder.
Family and family traditions.
So what is it about the family traditions, though, that impact health?
Well, usually if you grow up around someone that's used to smoking or drinking or bad habits, and like eating habits, or someone that has a sedentary lifestyle, usually you're going to adapt from your parents. So you'll take on their lifestyles.
Mm-hmm. Okay. So how do we think of that as a social determinants of health in terms of the condition? You're saying the family structure?
Yeah, like being, your family is part of your society, your social interaction.
Okay.
So having that is going to influence your, I guess, ideas in health.
Okay. So let's hold that. Let's like your family system. Okay. We'll put that down. What else? What do you want to talk about? If you're not going to Zumba tonight, what are we going to talk about here? And I'm thinking about the women that came because you want to know what's going on in your community. All right? Think about what is it that you'd want to talk about in terms of thinking about impacting health.
As we grow, we used to be conditioned or directed into the next phase. You go from a child up into a young boy, into a mature teenager, into a young adult, older person. But nowadays, it doesn't seem like we have the guiding lights that we need to prosper in health, or they're kept away from us.
So give me a specific example.
In the community, we have a lot of problems with children having children. Apparently, there is a problem either in the school, in the home, or in the church where somebody misses the boat. And it wouldn't be a problem if it was an epidemic. So if we talk about that, we could solve a lot of problems having to do with health.
So what's the specific issue you want to address? Is it the children having children?
No.
What?
Information. Because basically the information that you need is not being handed out. Information also pertains to, let's say, nutritious meals. Information has to do with a lot of things. If we don't attend to information and get it out to the community, we will constantly be doing the wrong things at the wrong time.
So you're feeling like what we need to do is really think about getting more information out.
More information into the hands of the families, to the school, and for them to act on it. Otherwise, we won't have the right solutions.
Okay. All right. What else? Thank you. So information. What else? Based on the conversation we're having and what you're hearing, what are some of the other things you want to talk about? Or what do you feel like would be some of the issues that you'd want to talk about to ensure that everyone has access to the resources so they can grow up healthy?
So, Steve, we're talking about the opportunities, like, for example, the Zumba class being an opportunity to change lifestyles.
Okay.
So some of the ladies that are coming here tonight or have been coming to the Zumba classes, this is an opportunity for them to change cycles for themselves, where maybe before they didn't have access to a gym, or I know with a lot of the other families, they say we can't afford to take your whole family to the gym. So having this free Zumba classes offers you the opportunity to make those small changes in your lifestyle that otherwise you wouldn't be able to have. So following that as a social determinant and seeing what opportunities we have that are available to us to make changes.
So information, and in this case, availability of resources. Does anyone agree with that? Could you tell me a little bit more about what that has meant for you, just to help us understand?
I live in Bear County, but I'm out on 1604 right by Randolph.
Yeah.
I don't have any of this.
So all of the things here, it doesn't exist. So how do you get here? How do you get here?
Well, I work downtown. And one of the ladies that I work with downtown was the one that mentioned to me about these classes.
So you got information through her, and then
That's-
why do you come to the class?
Like she said, to change, instead of going home and sitting there from,
Watching The Voice.
well, I'm gonna go watch it, but, but that doesn't start till 7, you know, I mean, right,
So
you
good
know.
for you.
I
So
can
what-
come here, do what I need to do, and break out a sweat for a while, and then go home.
Like, wouldn't it be just easy to go home and have a bag of chips?
No,
Like,
because I wanna work on myself, I wanna feel good about myself.
you want to feel good about it, okay. So, getting back to this notion of the individual stuff, that makes you feel good. For this woman over here, she talked about very eloquently about not feeling depressed last week, but this made her feel better. So it makes you feel better. It
Right.
makes you feel good. So what will keep you coming back? What will
As-
keep you coming back?
As long as I have access to it, I can
long
come
as you
back,
have
yeah, I
access,
can,
okay.
from work, come here and then go home.
So why don't we think about that as another area in terms of availability of resources? Okay. Anyone else?
You know, it's so hard to go anywhere like to the gym or anything because I have children and I don't have like babysitter or anything. I can bring them and they can participate too, and it's free. So that's kind of what brings me back to because I'm a paycheck to paycheck kind of person. I can't afford like
So for you,
to go
it's
for like a monthly
availability
fee.
of resources and being able to have someone take care of the kids for a little bit.
Well, they do it with me, so
They
that's
do it
even
with
better.
you?
Yeah. So that's
Where
what
are they
keeps me.
tonight?
In the little childcare
Okay, good.
over there.
So there's a resource for them as well as you?
Yes.
Okay. What is it, let me ask you before we go, what else do you feel like when we think about either social determinants of health or affecting health, what's something you would want to talk about?
Well, I kind of agree with that, like more resources, more availability to activities and stuff. Anything that I can do is in a family setting, I usually go to because I'm a single mother, so I'm with my girls all the time.
So for you, it's about the availability of resources, but because you're a single mom, you also have to think about
Right. So that'll whatever any availability, anything open like that, I'm usually willing to go and try and see.
So why do you come?
It's fun.
It's fun.
Yeah.
Okay. This will keep you coming back?
Mhm.
How long have you been coming?
Since it started.
Since it started?
Yeah. I've only missed maybe like 2 classes or something like that, but yeah.
How did you find out?
Through a flyer I read. I come to the neighborhood place often, so I saw a flyer for it,
Oh, so you come here anyway, but you saw a flyer and that made you...
and that made me come to this specific program.
Thanks for letting me interrogate you.
More information.
Okay, good. Okay, now for those who haven't talked, you know I'm coming by to find you, so get ready. Anyone else? What do you want to talk about tonight? This is your time. We've got a few things up there. Abby, what's the list? We got availability of resources.
So I grouped some things together.
Okay, let me...
Availability of information, and then availability of resources for individuals and families.
Okay.
We also noted, and this could fall in one of those categories, wanting to talk about physical activity opportunities for children, helping families make healthy choices, and teen pregnancy.
Okay. Does that sound like a pretty good summary so far? Okay. We still got a few more to go because I'm coming right here. What do you want to talk about tonight?
It's something like she said, helping family make healthy choices, because it's like what somebody said, I mean, we don't all have like an HEB or a marketplace close.
Can you say that louder?
So most people go to like the convenience store and buy just chips or something that they can put in the microwave or something like that. So something that they can get healthier, but.
You're saying something very important. I just want to make sure we all hear it, because I think everyone may assume, or not all of you, but I think some people assume everyone's got a supermarket near them, and that's not always the case. Sometimes there's a convenience store not selling the same things you find in a supermarket.
Yeah, I think like the closest HEB to my house is like 2 miles.
2 miles.
Yeah,
So
and there's a convenience store down the street.
So there's and what do you get at the convenience store? The same thing?
Yeah, but it's more expensive.
It's more expensive. Okay. So the availability of resources like what you would find in terms of a supermarket. Anything else? Oh, and you also talked about the whole healthy lifestyle, the choices as it relates to the family. Okay, great. That wasn't painful, was it? Okay. All right, this woman right here doesn't know I'm coming up behind her.
Well, we were talking about physical activities for children. I have a 17-year-old and I have a 10-year-old at home. And I live 2 blocks down. I have a basketball court that's on my sidewalk that I get fined and cited by the city all the time to move it because they can't be playing. You know, I can't have it on the sidewalk where they can play. But I'd rather have them in front of my house playing than off running in the street anywhere else. There isn't anything for my kids, physical activity close by to where they can play basketball, or there's community centers. There's Sonny Melendres way over there. There's Cuellar way over there. But one of my 10-year-old, one of his little friends that walked to Cuellar got run over and killed right there on Highway 90. I'm not going to let my kid walk to Cuellar to go play basketball. And why can't I have my basketball court right on my sidewalk where I can see my kid playing right in front of my house?
Well,
and a couple. I've been in this neighborhood for 17 years. Well, more than that. I was born in this area, and I've always lived here. When I first moved into my area, I live on North San Horacio, which is 2 blocks down. From Culebra on down, straight down my street, there are no stop signs. The stop signs are in the other direction. So a straight shot from Culebra all the way down, cars just fly down the street. And I petitioned and I wanted to have speed bumps put on that street because it's a straight shot, no stop signs. I even got hit once. I was going home. I got hit by a person that ran the stop sign, turned my car around, and I ended up facing the way that I came from. But nothing was ever done. I still don't have speed bumps. I don't want to say this, but I kind of borrowed a cone to put in front where my kids are playing.
Don't worry, we won't report you.
Where my kids are playing basketball, so the cars will slow down. But I mean, that's what I'd like to see, something for my children to safely, we want them to be active, we want them to be physical, but there's nothing here where they can do anything physical, you know, and then that's I have kids and.
This is great. You want to come on the road with us? So what you're talking about is the idea of physical activity opportunities right near the house. But you're also citing some things in the sense that, unfortunately, there's some ordinances out there that prevent you from doing some of the things, and then there are also not stop signs. You haven't been able to get the speed bumps. But you also took matters into your own hands and got an orange cone to kind of create your own safe environment.
Well, I'm a mom. I got to do
Absolutely. Absolutely. Great. Thank you. Anyone else? I just want to make sure we've got, we didn't talk to you. No? Okay, we'll respect that. Okay.
I kind of coincide with what she's saying. We need things closer to our neighborhoods. We need like parks, more parks.
Okay, more parks.
I live by Ray Ellison and Medina Bay, so by Lakeland, all over on the other side of Highway 90, and there's like nothing. The only thing closest is a park on Old Pearsall, and you kind of have to walk on the access road of 410, which is really dangerous, and there's no way to get any physical activity or community involvement. Like I have a baby sister who's always like, oh, let's go to the park. Well, sometimes you can't go to the park because you can't always drive to the park and you can't walk to the park. So there's no way to get physically active in your community without it being dangerous.
So again, this idea of having opportunities for physical activity closer by. Okay, great. Anyone else? Over in this back table, all these young women over here, you got anything else?
Today we had a doctor call us, and they told us that their clinic is the only clinic within 11-mile radius, and so I think to get more clinics would be to just
access to facilities,
mm-hmm.
and in this case, clinics. Okay. So, did we get everybody? We got everyone? So why don't we go through the list, and then what we'd like you to do is we'll set up different tables where we're going to talk about these areas, and you go to the table that you want to talk about this a little bit more, all right? If for some reason the issue is not what you want to talk about, we'll get something else and we'll have you move to another table, okay? So let's go through that list. Yeah, let's see how we can break it down to the top, maybe 3 or 4 things.
Okay. Availability of information.
Okay.
Opportunities to change lifestyles, or availability of resources.
Probably availability of resources.
Access to facilities.
Access, okay.
Safety.
Mm-hmm.
And then helping families make healthy choices.
Mm-hmm.
Teen pregnancy and physical activity for children.
Okay. So let's see, we're going to break you up into some small groups. So why don't we start with the availability of resources? How many people want to do the availability of resources? And that could be everything from the Zumba classes to what's in your community or what's nearby. How many people want to talk about that? Again, the availability of resources. Why don't we have you sit over here? So come on over, that grouping. Let's pick another one. Great. How about the next one in terms of information? In terms of information to make more information available about those resources. Who wants to do that? Information? Okay, we'll come back to that. Does anyone want to talk about the teen pregnancy piece? No? Okay. You do? All right. All right, we'll have a group of 1. That works. How about the families, helping families make healthy choices? Did you want to do that too, based on what you were talking about, or no? For a few minutes? Okay. Come on over. Yeah? So we'll have the 2 of you talk about the issue about helping families make healthy choices, because you both spoke eloquently about that, okay? And then over here, how about you all? What's that?
Are you listening more?
You could participate too. Come on and participate. You're going to join them? Okay. You're going to be a group of 1? Oh, the 2 of you are going to do which? Are you going to do the teen pregnancy or the information, or? Do you want to do that? Oh, okay. Okay, your plans. Okay. Okay. Great, got it. All right, so we've got 3 groups.
but they cost. They have, you know, they have from your dance classes to water aerobics, but they cost. You know, I tried the water aerobics, but it got too costly for me.
Yeah. So the resource exists. It's just that there's
It,
a cost.
right, it's
to
not
you.
free, exactly. You have to pay for it. And there were times when the instructors didn't show and they didn't make up the class. So it's like, okay.
Spend money.
Right. It got too
You're talking
costly.
about the geographic distribution of resources too. There's some things in some neighborhoods, but not close to where you live.
Right.
So even if it's there and you can't get to it.
Yeah, and the only, you know, I come because I work downtown, so I can get here pretty quickly. But my drive home is, you know, 45 minutes. So you know.
Right. So you have, that's another resource that I think a few people were alluding to. You have availability of a transportation resource. Are you able to drive? Is there good public transportation?
Well, the VIA goes through FM 78, which, you know, I can take VIA, but that's,
Going to the 2 miles.
Wait, tell me more about this.
The VIA isn't like there's not like great routes
Yeah.
anyway. Like if you want to go like a pretty long distance, like say if you live out somewhere, it probably doesn't go. Like, or it's like an unreasonable amount of time. I've gotten that before. Like I tried to go to like I had to go to the Bexar County courthouse for like a new ID or something like that, and I live about 20 minutes away, and the VA told me it was an unreasonable amount of time to get there. So it means it took over 3 hours to get there on the bus. Wow. Yeah. So.
Yeah.
Just within your county. And
Yeah.
I mean, I've tried the VIA, you know, trying to save money from gas and all that, and I can get it on FM 78, but it goes all through Kirby, all around the excess road of 35, and then it comes into Commerce and drops me off, you know, right there on Flores in Houston.
Right. So that system certainly affects how you can access, even when resources are available.
Right.
3 hours is not reasonable.
I have a car.
Yeah, I mean, I have a car too, but you know, I tried it to try and save money, but it's not, sometimes it's not worth it. It's like, and then on a Friday afternoon, oh my God, I think it took me 2 hours to get home, and all I could think of was that song, "The Wheels on the Bus Go Round and Round," and I was never getting home.
Certainly a different application of that song.
Yeah.
How about others? What is availability of resources? What does that mean for you living in this community? What other resources are or are not available to you?
Like what she said, grocery stores. Grocery stores are pretty far away sometimes. And if there are some, well, I know there's like HEB is really big here. I'm from Dallas, and like I know my house is like 4 miles away from like a grocery store. But I know like I live on the north side, and so I have an HEB 2 minutes this way from me, 2 minutes this way. But when you come down here, like I want to move a little farther south so I can be closer to my job down here downtown. And for me to get to a grocery store here, it would take me like a good 20 minutes.
And the grocery stores, they cater to the people of where you live. And the only reason I'm saying is because the HEB close to me is in Kirby. Not in Kirby, in Live Oak. Okay, so I go there. But then my dad lives right here by Las Palmas. So one time we were having a get together, and I was going to buy they have a real good crab meat spread for crackers. So I was going to buy it here. You know, we were going to get together at my dad's. And I come to the Las Palmas HEB where I've chopped, you know, because I was born and raised on the west side too. And I kept looking for it, and I couldn't find it. And when I asked the deli, I said, because she says, "What are you looking for, mija?" And I told her what I was looking for. "Oh, no, mija, we don't sell this here. It wouldn't sell on this side of town." You know, so, you know, certain things that you can find in an HEB, which is healthier than you can't find it. You know, they cater to the area that they serve. So, you know, that's exactly what she told me. You know, they don't sell it here because it wouldn't sell.
Mentioned it. I've also noticed that with HEBs, like I have one real close to my house, right there next to Blackland. But then I've also noticed that the people, because I work on Military Road, and everybody from that side on. There's no HEB. I'm just like, where are they? And it's like there's one on Marbach, then there's one on Valley High, and then there's not one till Zarzamora. That's far. So it's kind of. I never really thought about it until they were talking about it now. Like there's no grocery stores.
And why do you think that is?
I think what our opportunity is how we can.
I don't know. Because I either have, you know, the one on Kitty Hawk, which is in Live Oak, or I have to go all the way to 78 in Foster, which is in San Antonio. So, yeah, they're far apart. So I don't know why that
Did
is.
San Antonio ever have any other grocery stores other than HEB?
Oh, yeah, Handy Andy's.
It's closed now.
Oh, yeah, they're all closed now.
They're closed.
Now. Yes.
They used to have the market.
I guess maybe that's the reason, because there's only HEBs here.
They're the main grocer.
So there's a monopoly.
I mean, they get some competition from Walmart and Target.
Yeah.
Oh, well.
Target's really expensive for groceries.
That's the thing. Yeah, they're expensive.
So you were saying like they don't carry the crab dip up here.
Right, there's certain things that you can buy at one HEB, and then you become. And if you go to the Gucci Bee on Alamo Heights, you know, I mean, you can get all your healthy stuff there, and you can't get it over here.
We work with some of the folks at HEB, and we've been learning more about some of their stores, and they do carry different things at different stores. It's almost so they have value stores that tend to be in more of the neighborhoods that aren't the real high income neighborhoods, and then they have up stores, which are the fancy ones that probably sell crab dip and all that
I noticed
specialty stuff.
Right.
I noticed that because I go to school I go to Incarnate Word, so it's like right there.
Oh,
Alamo
yeah.
Heights, and I went to that Central Market, and I was just
Amazed.
Amazed at what
appalled.
they have.
Everything was super healthy, and I was trying to find this thing called like crema mexicana, which is like cream, and they didn't have it. They had Italian stuff, they had German stuff, they had Indian stuff, and I was like,
Come to USA.
I know, but I was on that side of town, so I was like, I'm going home. This is not cool. It was amazing how it was just so different. It was like it didn't even look like an HB.
So here, what do you think you could do here to get them to carry, the products you want, or to improve availability of other resources, physical activity resources?
How is it impacting?
I don't know. My cousin, he moved into the area. He wanted to live on the west side. He came from California, and he came with all these ideas and dreams, and he was going to come in and change the west side. I go, his name's Danny. I go, Danny, there won't be change because people are used to the way things are, and I think he finally gave up. He's been here maybe 5 years, and people are used to what they know, and I don't know, they're not going to change. You're just used to what you have, or you don't have. And it's too bad. I mean, I wish it wasn't that way, but like my son told me, this is just an example, the way they moved the carnival now downtown to the Alamo Dome, I told my son, ever since they moved it, we haven't gone. I told him, I'm not going, I'm protesting because I want it back to where it used to be. He goes, oh Mom, you're just one person. I go, I don't care, I'm still protesting. But, I mean, you do want things to be different, but like, I'm talking about my area because I live here. People are used to being, and I try, my cousin just moved into the area, and I've been trying to get her to come to Zumba. And I called her right now, come, we're having a meeting, it's a community. No, I'm making dinner. It's discouraging because some of us do want things to change and try to do things to make a change, but the majority of us are just not wanting to.
I was also thinking it's part of a motivation thing. Like sometimes we're like real embarrassed not embarrassed, like, I am.
Timid?
Yeah, timid to go out and do certain things. Like if there's a Zumba here, and if I lived in the area, I probably would have not come because I would have been timid because I don't know who's there or how it was, or, and now that I know, I'm more likely to come. And it's just, I guess, more of a motivation, like have like little flyers go around and just invite people, hey, we're having this, or like a list of events around the community.
Well, I was telling them, like here, they have this teen center that's sponsored or whatever by Best Buy. I mean, they have a sound booth, they have computers, they have the most, you know, modern technology for kids. I have a 17-year-old that came a couple of times and lost interest. He's not coming anymore. I mean, why though? I don't know why. He'd rather be out there playing basketball with his friends, which is doing physical activity, but I mean, I think this is so awesome in here. I wish I could come. Should I be here every day?
What do you think would keep him involved? I mean, in that or other things?
Yeah, why attract him to where he wanted to keep coming? I don't know. I came a couple of times and then I don't know why. And I told him, honey, they put this in our neighborhood. It's free. Just go in there and you can learn. I mean, it's a whole new world that will open up to you with all this technology and, you know, all this, the sound booth for them to make music or whatever. But,
Some of it, like the things you guys were saying, that it's about having other people. Like you're shy about doing it for the first time because you don't know who's going to be there. But if you have a friend or a cousin or somebody that'll do it with you, it's easier to get started.
I think that's what happened. He came by himself, and his friends came, checked it out, and they're like, whatever. And they don't come anymore, so he
goes where his friends are.
Yeah, he gets pulled with them instead of him pulling them over here. So.
Is there anything in this community where it's like everyone does X activity, or there's like a gathering place that everyone
Well, you know what? The front of my house. Because of that basketball court. And I've gotten, my cousin lives in front of me, and she's upset with me because they live there, bottled waters and trash. And the cars are passing by, and I'm sure somebody already reported me again. But these kids come from this junior high school, after school. I have about 10 to 15 boys in front of my house playing on my basketball court. That's where they get together before they go home. And you have their parents driving up in front of my house, picking them up, and slowly, surely, little by little, they start disappearing. But that's where they end up after school.
So you're a safe sort of gathering place.
Well, it's a basketball court and they want to play ball. But I mean, that's the lack of, you know, stuff that we need for them, to where they don't have to be hanging out in front of us with a basketball court.
Yeah,
you know?
There's some random little areas that I've seen around town that's just a basketball, like a little basketball area, like 2 little courts, and maybe like a field for soccer. But I've probably seen like 2 or 3. I think there should be more. And I think, I don't know, in some areas, San Antonio has a lot of land that they can use, like open to nothing, and they can just easily put a little playground there.
I think it's pretty awesome about what the mayor's doing right now with all the bike trails and all these greenway trails, and that's awesome. I love that. I'm getting everybody a bike.
Is it coming out here? Do you have availability?
Well, see, we don't have one close by. That's another thing. We have to drive or ride our bikes, which is not safe because we don't have bike trails here yet. But I mean, there's in Leon Valley, there's in Mission, there's in Pearl Brewery, but nothing here around us close by yet. But I mean, the ones that I've seen that are out there, they're awesome. They're really awesome by the Pearl and by the Mission, but you have to drive to them. We don't have access to them right here. But maybe, hopefully, before I die, we'll get one.
Well, you said yes.
And I can still ride my bike.
What else would you like to see other than expansion of the bike lanes? What would help improve availability of resources here?
Well, I really love the Zumba class, and I'll be really upset if they take it away from us right here.
We're continuing it with our Fit Family Challenge that goes on.
Huh?
We're continuing the Zumba classes with the Fit Family Challenge. So
with the city? Mm-hmm. I think we're still having it, right?
Yeah, we're still having it. It's all throughout the summer.
As I was driving here, I thought it was really neat that they were playing softball. I just thought, and they were really
I thought that was the coolest thing ever because I've never seen that where I live. Nobody does that. So
The what?
They were playing softball. They had a softball game, and the parents, I guess, were greeting.
Oh,
I
out
was
there
just
in
like, oh my god, that's so different. And
And
things
that's
like
for the
that.
high school right here
Oh,
next door.
really?
That's Holy Cross High School.
Oh, no wonder.
Adding maybe aerobics.
Maybe
aerobics.
here in Zumba class after another day, like Tuesday, Wednesday, or something. Another class like kickboxing, aerobics, or step, or
And you have all that across the street at the wine. But who can afford the wine?
Yeah, they're expensive too.
Yeah. You know, it's, I mean, just across the street here in General McMullen, we have a West Side YMCA. But
I'm live here in the west side, and I went to the south side for aerobics because in Cuellar,
Yeah, we tried Cuellar, and the same thing happened with that instructor. I mean, and we did pay. It was $15 a month, but the same thing. You know, sometimes she'd cancel and wouldn't make up the class. And like Fiesta Week, oh, forget it, she wouldn't be there. You know,
and Southside is every week. Southside is every week, and it's free. It's free. It's free.
And that is about.
That's where I've been going, and then Tuesdays, Wednesdays, and Thursdays.
Wow.
So, and when I heard that they had Zumba here, that's came over here today. But I saw that. Are you guys part of the Methodist Healthcare? I saw Methodist Healthcare here.
Methodist Healthcare is a member of the Health Collaborative.
Okay,
because that's one of
Wesley and
Wesley's
Southside
part
is
of the
the same.
Methodist Healthcare. The Wesley Community Center. That's where they have the free aerobics and kickboxing Tuesdays, Wednesdays, and Thursdays. You know where that's at?
Yeah.
Do you
Well, I
know
heard about
about
it
the
because I went
fitness
to
in the park classes too that the Parks Department has?
they're going to be on. They're going to have Zumba
Woodlawn, right?
At Woodlawn.
Woodlawn, yeah. They have it at parks around the city, but free classes too, and they have Zumba and yoga and different types of classes at different places.
I heard
those
I-
are free too.
How would that work in a park? Do you take a blanket, like if you're doing yoga?
If it's yoga, yeah, if you have a mat or they have mats there that you can put down on the ground, but like for Zumba and stuff, it's just on the grass with you standing up. But they have the instructors come out and do it for free, like instructors that work at the Y or
He's like,
private
Zumba
gyms.
should be over already.
I think that should go to the southwest side of town too, because they probably have that. They probably had like a Zumba once for like a couple of months, and then nothing happened. Then it just ended. We should have more stuff like that.
Sounds like geographic location
Yeah.
of the Northeast resources are really important, and cost obviously. So reducing cost or having no cost.
Okay, Wesley is free. It's free. All the classes.
Where is that?
It's in Sarsamota and Fitch.
Anything else? We need to wrap up in about a minute, but is there anything else you'd like to share? Either things that you would like to see here to help improve the availability of resources? Anything you'd like to share?
Maybe like a park or recreation center would be good, close by, like more in this area, right? Like what you said.
And I think more like somebody was saying about like the information. It is available, but it's not I mean, it's here, but you have to come in here to find it.
So how would we get information to you and your neighbors?
Well, through me, I have email. I have access to that, but there's a lot of people that don't. And I was telling her, I go, we need to do like a walkthrough in the neighborhood, giving out flyers or something at people's homes, mailing out mail-outs, walk-bys with flyers, because unless you drive by here and you see on the marquee thingy out there of stuff's going on, you don't know, and if you don't walk in here, you don't know either. So, like sometimes that I see cars, whatever, I'm like, what's going on? Nobody told me. What? I want to be there. But, we don't have the information.
Any other thoughts on how to get information out to people about the good resources that do exist here?
I think what she's saying
Yeah,
would work a lot.
or
Mail
walk
outs
through
or
and passing out flyers.
With pasting them on the doors with the sticky stuff. Well, just throwing them on the door. I'm pretty sure somebody will find them.
Great. Well, thank you so much for taking the time to talk with us. I think we might be wrapping up all as a group.
Yeah.
So, thanks for taking the time.
Cook dinner.
Well, maybe we'll see you next week, Monday. Please come on Monday.
We are going to have it Monday. It's going to be
So before people leave, can we just have 2 minutes? Okay? Sorry, I see people leaving, so I don't want a bunch of you to leave before. Can we just have, like, I'm curious to hear just a few observations that came out of the session you were in. We'll be done in like 3 minutes, 3 or 4 minutes. I'm just curious to hear any thoughts, observations, comments, what you talked about in your group. Oh, you're all so shy. Okay. And I just wanted to hear from these 2 other groups. We'll do it real quick. Okay.
What we talked about was communication, and we determined that there's 2 modes of communication that we can communicate to the public with. The first mode, the one that we like to do it in, is person to person, so that we can stand with the person that we're talking to and explain to him in fullness what we're trying to convey. Usually we can tell by the look on their face whether they're getting the information or not. And if we feel satisfied that the information is going across because of the gleam of their eye, then I think we're doing a good job. Then there's another method of communication, and that's through the commercial periodicals, radio, television, and everything else that's free to the general public so that we can get our news across. But the choice way of communicating is person to person. Am I right? Thank you.
Applause for this group. Thank you. This group, anyone? Just a short observation or comment? Anybody? Just like a 2 sentences.
Okay, so what we talked about was the resources that we have right now. One of the ones we mentioned was our family fitness, like our Zumba on these nights. Let me see. Health problems are diabetes among kids. People don't interact with one another, like neighbors, you know what I'm saying? Like getting families together, playing basketball, that type of thing. Nowadays, kids stay inside and play their video games, and they don't go outside. But again, that goes back to, is it safe outside for them to even be playing outside? And then we were talking about the basketball courts, how you get fined for having them on the sidewalk. Yes. And health impact from all of that is limited resources, jobs getting in the way of people being to actually like have a gym membership or get active. Families who live paycheck to paycheck. Also schools, a lot of the schools don't have too many resources, like they just have a basketball court and that's it. And maybe kids don't want to play basketball. So like the vision, for our vision was we want a really big park for younger kids, a track for walking. We also want, schools to have better resources for the kids. And also like maybe like role models to tell the kids, get active, go play basketball, go play tetherball, right? Yeah.
All right, well, thank you. Thank you. Any observations from this group? Just one person, real quickly. Anybody? Okay, thank you.
One of the main things that I guess we talked about was grocery stores and how they have certain things in different areas. Like in Las Palmas, they don't have certain things that the north side HEB has.
Okay, yeah.
So the Gucci B. And another thing they pointed out was I guess the availability of like resources like a recreation center or like a playground. Yeah. And so.
Okay. All right. Well, thank you. Thanks for your work too. All right. Before you go, Steve is just going to let us know what's next. What are we going to do with all this information?
Yeah, I'm Steve too. We are tocayos, these 2 Steves here. So I just want to thank you. My name is Steve Blanchard, and I'm chair of the Bexar County Health Collaborative. And I don't know whether Liz might have spoken about that earlier, but it's a group of, you did speak of that? Okay, cool. Then let's talk about what's coming up next. to us, and you may have already said this, in the assessment is the key piece of the whole thing. It's the voice of the community. It's what residents of the community have to say, both from the standpoint of issues and strategies for improving health. And I heard a number of the topics, or overheard it. The two Steves met with the mayor this afternoon, and he's very keen on neighborhood context and helping neighbors change the context of their neighborhood as best they can, all with the idea of improving health. So this is not just a conversation that we have here and then it sort of disappears into the night. It goes forward as a report, and the mayor is very engaged in this, as is the county and all. So you speak a powerful voice, and there are powerful listeners out there. So I thank you for taking the time, and you will see the change come from this. These kinds of things that we talk about, even if they were to put the lights up on or put the park out there, it would take a year, 2 or 3 years for all of us getting out there to begin to feel the way we want to feel. It takes practice and exercise. Like when you're standing there having those conversations and your leg is up like this because Jennifer was burning the calories for you and all that, or whatever you were doing, you know. It takes a while, but I want to thank you for coming out tonight, and it's good to have the community voice at the table. Thank you very much.
All right, folks, thank you. See you at Zumba next week.
Yeah, some of you thought you were going to Zumba. Oh, they did? Thank you. Well, we were laughing like this.